Hello, today I will be reviewing the Literacy for Environmental Justice Youth Envision Good Neighbor program for the CBPR final case study. To begin, this project was a local campaign primarily aimed at policy development and advocacy to reduce the number of tobacco company subsidiaries, food products, and tobacco advertisements, as well as replace them with healthier food alternatives. The CBPR partnership was spearheaded by San Francisco Department of Public Health's Tobacco-Free Project's Literacy for Environmental Justice program, which is a youth empowerment and environmental justice education initiative which originated to form a CBPR partnership. The CBPR project also involved an outside research evaluator and communicated with elected officials. One aspect of CBPR approaches, which I'm personally interested in, is capacity building, and you can see the different areas in which the youth were engaged in this project. The project specifically mentions that community-based participatory research, what I have been referring to as CBPR, was prioritized because of its commitment for action. Because this project aimed to influence policy, the organizers looked at policy change as suggested by past researchers as an action component. Furthermore, the general origins of this project began as a grassroots community initiative, which I'll provide more detail on in the next slide. Their need to involve and gather feedback from legislators also positioned CBPR as an effective approach, and finally, the approach complemented the organizational philosophies at work. The stages of a CBPR partnership generally begin with the identification of a problem and progress towards deciding on a research question and conducting the study, and then developing and implementing action plans and evaluating the outcomes. During the action phase of CBPR, there are, or at the time of this study, limited guides for interventions that pursue policy-related action. Therefore, this project looked to the field of policymaking to guide the development of a clear pathway through which CBPR can leverage its research findings and translate them into policy change. Here's a general framework or the steps taken by the LEJ project. To back up a little bit, the focus of the tobacco-free project is to educate youth and communities about the impact of tobacco globalization and the tobacco food subsidiary globalization on people and communities locally and in other countries. Thus, the relationship between health and the corporate dominance of the food system became an integral part of the LEJ's partnership's problem definition and later the policy intervention. Two important local developments also took place early on and were foundation builders, a term used by the TFP project staff and San Francisco's Department of Public Health of the Good Neighbor program. One being a group of community elders met regularly in the early 1990s to discuss the problem of corner stores. These were small local businesses selling disproportionate amount of alcohol and cigarettes on San Francisco's Bayview neighborhood main thoroughfare. This attracted loitering and vandalism, and it was the group's initial idea to have these stores become good neighbors to deter crime while also improving the quality of food they offered. Together with other local efforts and with the strong support of a charismatic community leader who later became a city supervisor and key informant of this project, these early stakeholders helped identify food security as a key community concern. Many other preliminary developments helped lay the foundation for the LEJ Partnership's Good Neighbor program, such as a community organizing around toxic issues, participatory research, and forums by local environmental organizations, municipal efforts that prioritize food insecurity through environmental justice programs, and health impact assessments. CBPR partnerships are typically brought together to research and solve a health or social problem identified by the community, so they commonly begin by identifying and defining the problem. To identify a problem for serious policy consideration, a foundation of research is needed that may dictate policy action. CBPR partnerships necessarily participate in some type of research as part of their endeavor, contributing needed data to identify new problems or issues and proposing solutions to address them. The LEJ partnership undertook several types of research approaches. With training and ongoing technical assistance from their health department and evaluator partners, LEJ youth and project staff designed and conducted a brief 4-question survey with a convenient sample of 130 residents on a heavily trafficked Bayview Road. The survey covered needs and desires relating to local markets, healthy behaviors and daily nutrition habits, and what incentives or changes it would take to get the public to shop locally. The partnership felt strongly about building relationships with merchants, so during this initial problem identification phase of the project, in-depth interviews were also conducted with merchants at 5 local corner stores. The LEJ youth also conducted store mapping research in all 11 Central Bayview corner stores to determine how much shelf space was devoted to fast foods, tobacco, liquor, meat, and fresh produce. To gain additional information for better defining of the problem of food insecurity in Bayview, LEJ Youth used GIS mapping to produce maps that highlighted locations of corner stores, supermarkets, and grocery stores, and transportation routes, and relevant demographic characteristics of the communities were all overlaid. Here are some of the important findings of the Community and Merchant Survey. And here are the findings from the store mapping research component. The youth used an innovative diagramming method that estimated shelf space using quadrigraph paper with different colors used for various products and measured them. Building on what they had learned from TFP about the relationship between tobacco and food companies, the youth also counted the total Kraft Foods and Nabisco products as a percentage of the total number of products sold. The youth found that, at the time of the study, an average of only 2% of the shelf space in 11 corner stores was devoted to fresh produce, whereas 39% was allocated for packaged foods and 26% for alcohol and cigarettes. Furthermore, the top 3 non-tobacco or alcohol-related products available at these stores were cookies, cereals, and crackers, and that Kraft Nabisco made 90% of the cookies and nearly 80% of the cereals and crackers, many from which had high sugar, fat, and salt content. Finally, youth learned that 47% of tobacco products and 41% of alcoholic beer products were owned by Philip Morris, which is the largest cigarette manufacturer in the United States and whose products are sold in over 180 countries. Findings from the GIS map showed that census tracts where the majority of the Bayview population live are primarily hillside areas, whereas the local grocery stores are in the flats, more than 1.5 mile away. When transportation routes were overlaid on the maps, they revealed that existing public transportation requires about 1 hour and an average of 3 bus transfers from the Bayview Hills to reach the closest supermarket. The problem identification phase of the project, in short, included a multi-pronged approach to data collection and provided relevant information about diverse dimensions of the problem of food insecurity in the Bayview neighborhood. The LEJ partnership focused on policy agenda setting by strategically fitting the timing of food security issues within the larger, historically based concerns about the community's redevelopment following data collection and analysis. Developing a policy action plan in a CBPR partnership involves community participation in the interpretation and translation of research findings into concrete policy actions. Disseminating their research finding to key local partners helped the LEJ partnership set a local policy agenda that prioritized food security. The partnership built relationships with local policymakers to determine their interests in the issue and to gain their support and strengthen their visibility for agenda setting. LEJ's long relationship with Supervisor Maxwell was credited by the community partners as opening the door to city agencies and spearheading the Good Neighbor program. The city-based priorities of redevelopment and community violence also may have served as windows of opportunity to produce an ideal environment for opening the discussion about food insecurity and its connection to community improvement. revitalizing the area and decreasing the violent crime focused mutual attention on corner stores, which became their primary policy target. For all policy options they considered, the partnership went through a deliberate process to determine who the key players were and whether they had an appropriate contact or policy connection. After after getting to know the merchants and their circumstances, the LEJ partnership considered the foremost policy alternatives, one that involved working with merchants instead of penalizing them. Here are the types of health promoting changes corner stores were voluntarily able to make in exchange for incentives. Corner store incentives and health promoting changes were secured through a memorandum of understanding that the LEJ partnership helped develop under the direction of the advisory committee. To help decide how this voluntary policy might work with merchant criteria and incentives in place to improve access to healthy food products, the LEJ partnership decided on an intervention at one pilot corner store in the Bayview, which was named Super Save. Together with the support of the Good Neighbor Advisory Committee and the TFP's grant, LEJ launched a 6-month Good Neighbor store pilot in December of 2003 with the incentives provided by several city agencies. The pilot store intervention was seen as a local success with broad interest in replication and expansion. SuperSave's manager reported in July 2004 that these efforts led to an increase in fresh produce sales that went from 5% to 15% in the first 7 months of the Good Neighbor involvement. Alcohol sales were also reported to have declined from 25% to 15%. The latter change was believed to reflect the fact that fewer individuals were coming in the store solely to buy alcohol, now that the store had a more family-friendly ambiance and decreased alcohol advertising. The LEJ partnership then secured additional funding through the California Endowment and the TFP to expand the Good Neighbor program to a goal of 8 corner stores in the Bayview area and to evaluate their efforts. LEJ is the lead partner on these expansion plans and has 4 city agency partners. Community and TFP partners stated that the combination of research and media coverage both raised awareness of the issue and influenced policymakers. Policymakers at the city government level have credited the LEJ partnership for producing credible research evidence for food insecurity in Bayview and for playing a key role in persuading policymakers on the importance of the problem and an appropriate policy solution. This partnership made an impressive series of policy-related victories in only 3 years. These include youth-led research on the understudied problem of food insecurity, a successful pilot Good Neighbor store intervention, community outreach and education to influence community knowledge, the development of a city and foundation-sponsored initiative to expand the Good Neighbor program, and state legislation to support similar efforts throughout California. The success of this effort expands the potential for involving youth in a policy-focused process to promote healthy environments in our most challenged urban communities. My primary critiques or future considerations for similar projects would be to work to build more pilot programs for a bigger sample size and to provide more conclusive and targeted evidence of its impact. Furthermore, I would recommend more systems thinking to be added to the preliminary research. For example, this could include sources of income disparities, job access, and other initiatives aimed at public health, nutrition, and consumer protection activities. With that said, the CBPR project was an exceptional example of using CBPR to develop and build policy, strengthen and enhance community capacity and organization with evidence. Though this community initiation was limited, as well as the detail on social action outcomes beyond policy, and the idea of joint data ownership was limited in this discussion, the ethical aspects of the pilot and policy, the varied research methodology, capacity building, and community relevance was paramount in this project's success. Furthermore, the communication and effective feedback loop that was early established with lawmakers proved to be an important starting point for potential community initiation, social action outcomes, and long-term social adherence and behavior change that work to promote healthy food alternatives, and health promoting environments.